We offer advanced medical and integrative health. That means we heal you with non-surgical medical treatments and preventative solutions. We are a complete health solution focused on you. We treat more than just your symptoms. We provide a complete health solution for your specific needs regarding your recent injury or existing pain conditions. Our team of board-certified physicians and health professionals are dedicated to helping you relieve your pain without surgery and ultimately help you achieve a healthy life, to feel better, to live better.
Every day we will hear stories, about how much better the patient is doing. A lot of them are like family. I mean, we've changed their lives. They referred their family to our clinic to get better. And it's a great feeling. It's a great feeling when you're doing a lot of good for the community.
I aim at trying to, improve their life as much as I possibly can. Not only do I want to help their pain, decrease in severity by different treatments that we offer, but I also want to make sure that they're being treated as a person, that all of those other things that go into being a chronic pain patient are addressed.
I became a doctor because I really wanted to find a way to improve a person's quality of life. And it really helps to give people hope. And what I like about medicine, and especially this specialty, is that we have a way to give people hope.
When I see someone that comes in that I know is truly in pain, I hurt with them. I really do. Not from the physical standpoint that they hurt, but more from that mental standpoint, because pain is such a subjective thing, and it really makes you hurt with them, and it gives you the opportunity to try to help someone. And I think that's the important thing. You really want to try to help them to relieve some of that pain, to improve their quality of life, and that's what we're trying to do.
I really appreciate working with people. I love the strength that I see in patients that are they're fighting for their lives. And to be a part of that is really rewarding and powerful.
It's most important to me to determine what's the cause of the pain so I can treat the pain most effectively and help that person live their life with less pain.
The difference with our program is the people. We really do care about our patients. We are knowledgeable in dietary recommendations and exercise, and we can help you make those lifestyle changes, but I think we really care.
Our complete health solutions include comprehensive treatments, procedures, and services for you. Spine, joint, nerves, and muscles, diagnostic testing, osteoporosis clinic, platelet-rich plasma therapy, PRP, physical therapy, medical equipment, lifestyle counseling, pharmacy, laboratory. Our goal is to decrease your pain and help you maintain a healthy, active life. Diagnostic testing is the latest technology to diagnose and treat your condition, utilizing nerve testing, ultrasound, and image-guided diagnostic injections. For those patients that have symptoms of pain, numbness, or muscle weakness of the neck, back, hands, and feet, we offer electromyography and nerve conduction studies, also known as EMG/NCS. This procedure is a recording of the electrical activity in the muscles and nerves. It can help us to discover the cause of muscle weakness, numbness, or pain. Diagnostic ultrasound provides real-time, high-resolution imaging that is helpful in diagnosing as well as localizing tendons, ligaments, muscles, soft tissue, and surfaces of bone for more accurate injections. It allows the physician to visualize the body part in motion.
There's a gentleman who I was able to help with electrodiagnostic study who presented with bilateral grip decrease and tingling in the 4th and 5th digits of his hand, and found there was a particular impingement of one of the nerves that goes to some of the muscles of the hand and the 4th and 5th finger. By defining that and locating that abnormality, we were then able to use our ultrasound, musculoskeletal ultrasound equipment to visualize an injection to the area where the inflammation was irritating the nerve. And then he had about a 90% response with that treatment, and it enabled him to do his job more effectively, and was really a big deal for him with respect to that particular condition.
A bone density test, DEXA scan, is considered the most accurate way to measure bone mass. It helps detect bone loss before fractures occur, diagnose osteoporosis, and monitor response to treatment.
Unfortunately, osteoporosis is often not diagnosed until someone fractures or breaks a bone. But what we would like to do is to screen people so we can diagnose it sooner and treat it and prevent it from progressing.
We offer a variety of advanced non-surgical medical treatments to relieve and manage your pain.
Whether it's spinal injections or joint injection, when we give the numbing medication, if we're in the right area or the source of the pain, then one, it will take away the pain, so we know that's the source of the pain. And two, when we give the corticosteroid or a strong anti-inflammation medication, it is therapeutic. So the term diagnostic and therapeutic injections is that.
Epidural steroid injection is an image-guided procedure commonly used as a pain relief treatment option for people with pain originating from the spine and radiating down the arm or leg. Facet joints can become painful due to arthritis of the spine, injury, or mechanical stress. The goal of facet joint injections is to help diagnose the cause and location of pain and also to provide pain relief. Other types of injections that treat neck and back pain that may be performed include medial branch nerve blocks and radiofrequency ablation. These procedures can provide long-lasting pain relief from arthritis, progressive aging, and injury by numbing the nerve supply to a painful facet joint. Kyphoplasty is a minimally invasive procedure to treat compression fractures of the spine related to osteoporosis or cancer. The goal of kyphoplasty is to restore the bone height, stabilize the fracture, and reduce pain and spinal deformities. Implantable devices are an option for chronic neck, back, and arm pain when relief is not achieved through traditional methods. The spinal cord stimulator, SCS, is an implantable device that uses pulsed electrical signals to the spinal cord, causing the pain sensation to be blocked and replaced with a more pleasant sensation.
We have several patients to choose from, obviously, but one of the ones that really stands out in my mind is a younger patient who unfortunately had gone through a pretty bad car accident in their younger 20s and ended up having to have surgery, but then was still having a lot of pain following surgery. This was a patient who had 3 kids, and one of their major complaints was that they were in so much pain on a daily basis that they weren't able to play with their children. They weren't able to really interact with their children. They stayed in bed a lot because of the symptoms they were having. So of course we went through the trial process, which was fantastic, and they decided to go on to implant, and now they're, taking their kids to Disneyland. So, it really can be a life changer.
An intrathecal drug pump, ITP, is an implantable medical device used to deliver small doses of medication directly into the body through the spinal canal. The benefits of the device are that a patient can achieve pain control with lower doses of medication as well as less side effects. Our center offers comprehensive care for many types of painful joint conditions. The most common cause of painful joints is osteoarthritis and inflammatory arthritis. Steroid injections can also be used to relieve inflammation caused by arthritis. Steroids are relatively safe and effective when used appropriately in small doses. When the sacroiliac joint becomes inflamed, it may cause pain in the lower back, buttocks, abdomen, groin, or legs. The goal of the sacroiliac joint injection is to help diagnose the cause and location of pain and also to provide pain relief. In addition, hip arthrogram is an image-guided technique to introduce steroids into the hip joint and diagnose the cause of the pain.
This was a person who had been suffering from pain for a while and had an undiagnosed fracture. She was sent to a surgeon, and it was decided she didn't need surgery, so we treated it conservatively. She received some injections in her hip along with some physical therapy, and now the fracture is healed and she's feeling a lot better.
Joint fluid replacement therapy is designed to provide pain relief for patients suffering from osteoarthritis in the knees. Muscle injections are another treatment option in relieving pain. Trigger point injections are used to treat painful areas of soft tissue and to reduce localized areas of muscle spasm.
A patient who had chronic neck pain, She suffered from arthritis in her neck for years and could never figure out how to get it relieved, and it really interfered with her ability to enjoy her life and to enjoy her children and her grandchildren. When I saw her, I did a workup on her, x-rays and MRI, and realized she did have arthritis in her neck. And the way that we treated it was with physical therapy and with trigger point injections in her neck. She has found that since she started having trigger point injections in her neck, and since she completed her physical therapy program, her neck pain has gotten so much better that she rarely needs to take any pain medication.
Botulinum toxin is FDA approved for the treatment of migraine headaches, abnormally tight and painful muscles in the neck, back, lower and upper extremity spasticity caused by a variety of muscular and neurological diseases. Botulinum toxin is produced by naturally occurring bacteria, which causes a relaxation of muscle tightness. Platelet-rich plasma therapy, also known as PRP, is treatment for recent and chronic muscular and skeletal injuries such as muscle tears, damaged ligaments, tendons, and joints. PRP stimulates the body's natural healing process and is designed to relieve your pain and accelerate healing at the site of injury or inflammation.
This individual is a lady who is an accountant, had had shoulder pain for a number of years, had 2 different shoulder surgeries that had improved her condition by about 75%, but she had persistent pain in the posterior shoulder. She had had all different types of treatments, medications, therapies, injections, and actually when I presented to her the idea that maybe an area of her muscle tendon of the posterior shoulder had not recovered fully and had been stuck in a state of disrepair, we then proceeded to provide the PRP injection to that location. The benefit that she had over a period of 2 to 4 weeks was actually profound, and she requested an additional injection because there was now lateral shoulder pain that was still there, but the medial shoulder pain had resolved. We did additional injection using the PRP, and virtually all of her pain resolved within about a 2 to 3 month period of time in a location and with a severity that had been present in her words for years. She actually used the phrase, "This has been life-changing to me because of the benefit that she had gained."
In our osteoporosis clinic, we offer comprehensive evaluation, bone density testing, treatment, and prevention programs. A personalized treatment plan will be developed that may include nutritional modifications, dietary supplementation, physical activity recommendations, lifestyle choices counseling, and medications that treat bone loss.
The primary purpose of the visit to the osteoporosis clinic is to educate the patient on the disease, to do a very thorough history and find out the risk factors that have put them at risk for osteoporosis. And then we also talk about treatment options for the condition.
We offer physical therapy, evaluation, and treatment to recover from injuries and relieve pain, build muscle strength, and improve your flexibility and activity level. This may involve manual therapy, electrical stimulation, and ultrasound treatment, as well as hot or cold therapies.
The one patient that I can remember the most is I had a lady come in with a bilateral knee replacement. She was in very bad shape. She was actually in rather poor health, but they did the replacement anyway. She came in a wheelchair, and 6 weeks later she walks out with no cane, no crutch, and is virtually pain-free and was back to full function. And I think that's the reason that I do this job, is for that reason right there, is to get a patient like that you can help along the way and return them to their normal lives, which is the goal for every patient.
We also provide medical equipment which is available to you in all of our locations. This includes bracing for the neck, back, wrists, knees, and ankles, providing support and pain relief.
What we do here, it's a collaborative effort with the doctors to do everything we can to make people feel better.
Lifestyle counseling, also known as behavioral therapy, helps you discover the best way to live your life regarding stress, food dependencies, coping with pain, and everyday personal choices. In our pharmacy, all your prescription needs are filled on-site or mailed to you. You can even set up to auto-refill your daily medications, such as blood pressure, cholesterol, diabetes, pain, and compounding creams. Prescriptions are also accepted from outside physicians. At our own laboratory, we complete all blood work panels plus genetic testing to find out which medications work best for you. With our patient portal, you can message our office, view your current medications and lab reports, manage your appointments, view and pay your bill, as well as update your personal information and insurance. We are here to help you with our non-surgical medical treatments and preventative solutions. We're a complete health solution focused on you. Our goal is to help you feel better to live better.